Hey, this is Real Talk, and today we talk body dysmorphia, or BDD, or body dysmorphic disorder. What is that? It's a psychiatric and a psychological condition that's been classified by the DSM, or the Statistical Manual for Diagnosis 5, which is like the fifth edition of the Psychiatric Bible. It's been classified as a OCD, or obsessive compulsive disorder, which is a anxiety disorder, and it's related to when an individual has a preoccupation with their physical appearance. That could be physical appearance on a number of factors, because a lot of people will think of body dysmorphia and think, oh, somebody just perceives themselves to be overweight or they're obsessed with their weight. But it's a bit more than that. It's their weight. It can be their weight, or it could be their shape. It could be their height. It could be their presence of facial hair. It could be the absence of facial hair. It could be their skin texture or quality, or having thoughts related to that. They have a poor skin appearance, or a number of physical factors that they feel is flawed. They feel that they feel in themselves, or they think to themselves that it's making their appearance undesirable, and they feel extremely self-conscious, and at times, in extreme circumstances, it can be self-loathing. I have spoken with a number of peers who are psychologists or psychiatrists, and some, I've heard it said, perceive it as more of a Western phenomenon. And in some senses say, what are the reasons for this? Some people think that people in the quote unquote developing world, or parts of what is referred to as a developing world, have more pressing factors of life to take care of: food, clothing, and shelter. If those things are in short supply, or are in doubt or in jeopardy, you're less likely to be consumed with your bodily appearance. But that's the inference of that, is if to say that this is something that people are necessarily choosing to have, body dysmorphic disorder, which I would beg to differ. People as young children, as young as primary school age, have been recorded as having been diagnosed with BDD. It seems to mainly affect young women or young girls, mainly. However, there is totally substantiated cases of men of various ages having been diagnosed with BDD. But oftentimes it is women or females that are affected. Also, there's something known as, or there is a variant of BDD, which is called muscle dysmorphia. This tends to be something that is, as you can imagine, mainly experienced by men, oftentimes younger men. And again, it is a real psychiatric condition. It's different from when we use this term in popular culture, oh, he's obsessed. It's different from when somebody just has a really intense liking for, or awareness, and just really into a particular thing. But muscle dysmorphia, signs and symptoms, what are they? Somebody can be obsessed with the absence of their athletic build, or the presence of the absence of an athletic build, or the lack, or what they perceive as a lack of muscularity, forever chasing that six-pack, or thinking that they're overweight, or that they don't look athletic when they quite possibly do. It can lead to obsessive dieting regimes, obsessive training regimes. And remember, this is for people who are not necessarily in competitive sports, but just this obsession for the look, for the aesthetic. So the dieting and the training is not based on being enhancing their performance, or trying to make weight because it's a combat sport and it's a weight classification or something of this nature, or based on long hours of training because of need for endurance. This is strictly based on trying to achieve the ideal physique. And in extreme cases, it can even lead to the abuse of anabolic steroids. Now, there are treatment plans or methods of treatments available for somebody experiencing either of these psychiatric conditions. But one of the things to bear in mind before we even go there is that because it's an anxiety, anxiety type disorder, even with the best will in the world, if you have somebody who you know is experiencing this or experiencing these symptoms, and you try to, let's say, assure them that this is not the case, that, you know, they look fine, their skin is fine, their nose is not this particular way, that they can see this particular ridge or whatever it is, a thing that they're obsessed about, and they feel compelled to keep touching. They're obsessed with the mirror, or at times they hide from the mirror because the mirror is a reminder of this particular condition, this particular bodily organ or thing about themselves that they don't like. As much as you try to assure them, reassurance doesn't work. It just doesn't work in a sense of it doesn't even surgery doesn't seem to really hold work. If somebody feels like they have a problem with a particular part of their body, for example, and they was to go as far as to have surgery to have it removed or have it altered, it doesn't mean that they're going to necessarily turn around and be happy. They become obsessed with the new form, or the surgery wasn't quite right. And as I said, it's more of a psyche. It's more not about the fact if there is a problem, but their perception of the fact. So one of the treatment plans is that they can be given, if somebody has this kind of condition, they can be assessed by a general practitioner, a qualified medic, and they can be diagnosed with medication that treats anxiety, or they can be given talking therapy. They can be given access to talking therapy. The preferred therapy for anxiety disorders is cognitive behavior therapy, or one of the models of cognitive behavior therapy, or a combination of both. As I mentioned before, there are some people who feel like because BDD is a Western phenomena, that it's not a real psychiatric problem or real psychiatric or psychological problem, but it's in people's imagination. What are some of the causes, potential causes? They are quite unclear, in the sense of, is it the individual having a anxiety disorder that is manifested in this particular way, or is it external stimuli? We do know, we can't blame the media, but we do know that images of beauty and standards that are prevailing in the popular culture, in the media, on the billboard, throughout Western society in particular, they hold certain ideals for men and certain ideals for women in terms of physical aesthetic. And this is why some would say there's a correlation. It's not enough to establish a cause and effect, but at least this is, when we establish correlations in research, we say there's a co-relationship, so it's something of interest. Maybe we need further research to see if there is a direct causal link between what people are exposed to, the standards that are held up, and how it influences them. But been a pleasure. Like I said before, if you know somebody who's experiencing this condition and you want to encourage them to do the right thing, possibly to speak to their GP, who is a qualified and trained medic, as a first port of call. I hope to see you next time for another edition of Real Talk.